Hi, I'm Josh, one of the physios up here at Mount Barker, myPhysioSA. This is the fourth video in our back series, and today we'll be talking about management strategies, things that you can do straight away to start to help with your back. So straight off the bat, there are a few things that can be really helpful. So one is staying positive, which is sometimes really hard to do when you're getting back pain and it's affecting how you move and how you do your everyday activities. But remaining positive actually has a really important effect. Knowing that your back is actually going to get better is really key. That with movement and with some of these strategies we will be able to help things, and that most back pain will get better within 6 weeks is a really key thing. So try and stay positive. That's a really important thing in terms of how our brain processes all that pain and all that information that's coming from our back. If we're too negative, it can actually have a negative impact onto our back pain and make things actually worse and stop us from moving. So really key to stay positive and to stay on top of your emotions as well. You might be using pain relief is also really important in these early stages as well, and you may need to get some advice from either your pharmacist or your GP about that. But most of the time, over-the-counter medications like anti-inflammatories or paracetamol, when used as instructed, can be actually really appropriate in this time. But you may need to check if you've got other medications or how that interacts with other things as well. So things that you can do when you're sitting to help as well. So you can use like a rolled up towel on the small of your back, and that might help to just change the position for your back and give you a bit more comfort when you are sitting. But also remember that you need to move, so don't stay sitting for too long. That's really important. When you're lying as well, sometimes trying to get to sleep, that can be uncomfortable. So things like lying on your side is often a bit more comfortable with a pillow or a towel in between your legs, with your hip and knees bent up a little bit more. That can also be a comfortable position. Other things that can be really helpful is some simple things like a heat bag or a wheat bag. Adding some gentle warmth around your back to help your muscles to calm down and relax can be really useful. There are some people that find that ice, so cold, helps with that as well. So if you can relax when you've got a cold pack on your back, that may be helpful, particularly in the initial parts when you first injured your back. But apart from that, heat generally tends to work quite well for most people. Just make sure you're careful with your heat and you don't have it too hot or burn yourself. So the other thing that can be really helpful in managing your back is some stretching, so some movement. We talked about how important movement was. So we've attached some exercises that Ellen, one of the other physiotherapists, has demonstrated, and that should be attached on your email, and you can look through those. Now, these are gentle exercises, they're safe to go through. They're not going to damage your back, but you do need to be careful that they're not causing lots of pain. They shouldn't cause lots of pain. That should be gentle and relaxed movements when you're going through those exercises. And you still may need to touch base, or it's still really important to talk to your physio that you're seeing about how you can move and about what exercises are appropriate for you, and then how we can actually progress those. And we talked about pacing as well. And so some basic exercises and then progressing them through and adding other things to help get you moving more is actually really important. So that was the fourth video in our back series. Again, I hope you found that really useful. Refer to your email for further notes and look at those exercises that Ellen's gone through too. Just make sure you stay safe with those and that they're not going into any huge amounts of pain with that. Good. Watch out for our next video where we will talk about how you can strengthen or start to restore some of those normal muscle activity around your back.